Hey, are you suffering from any type of knee pain, particularly in the lateral portion of the knee? Do you feel this pain when you're going upstairs, running downhill or uphill? Well, if you are, you're most likely suffering from IT band syndrome, and that pain that you're experiencing is due to a fat pad that's getting compressed from the iliotibial band and causing those symptoms of pain. Now, this pain primarily is initiated when the knee is at about 20 to 30 degrees of flexion, for example, going up or downstairs, okay? So the way we want to heal this issue is first, you want to get it diagnosed from a professional. After that, we want to stop any type of uphill or downhill running. So we're running on primarily flat surfaces, and we also want to be careful going up and down stairs. Once we do that, we then want to start to heal the tissue. And the way we're going to do that is first, release the musculature in the hip that's pulling on that IT band, that's causing that compression of that fat pad, is causing those symptoms of pain. After that, we're going to retrain the biomechanics of the knee so we don't irritate the musculature involved in the IT band and reproduce those symptoms in the future. All right, so the iliotibial band originates from the tensor fascia lata, which is a muscle that inserts into the IT band. You also have the posterior lateral portion of the gluteus maximus that's also inserts in the IT band. And then it travels down that lateral portion of the leg into a spot on the tibia known as Gerdy's tubercle, okay? And right under Gerdy's tubercle is where that fat pad is located, which can get compressed. So in order to stop that compression of that IT band, we want to release the musculature up here. So we're going to start with the tensor fascia lata. And for this one, it's located on the anterior aspect of the hip. So you're going to want to lay on the foam roller and just apply as much pressure as you can just on that front of the hip. You can kind of go from this bony aspect at the top of the pelvis down to about the first quarter of the thigh or so, okay? After you've released that, we then want to work on the gluteus maximus. That's that posterior lateral portion. For this one, same kind of thing. We're just putting pressure on that area. And general rules of foam rolling is you want to wait until about 50% reduction of tenderness or about 30 seconds to a minute of foam rolling, really compressing down those sore spots, okay? The last area we want to focus on isn't necessarily the IT band, but it's a muscle that adheres right underneath it. And that's called the vastus lateralis. It's a quadriceps muscle. So for that one, you're going to be going down the lateral portion of the leg. Don't go past the knee because we don't want to irritate that fat pad and make the symptoms any worse, okay? So you're going to roll up and down, again, focusing on those tight, tender areas and holding it there, okay? And then once that's released, we're going to start working on some. All right, so to properly stretch the IT band, we're not really stretching the tendon. We're actually going to be stretching the muscle bellies up here. So to do that, one way you can do it is to start, you're going to take the affected leg and you're going to put it underneath the good unaffected leg. Then you want to shift your pelvis over towards the affected side as much as possible. So you're kind of in a C-shaped position and you're getting a little bit of stretch in that pelvis. From there, I like to use my foot at the bottom to rotate my thigh in order to get more stretch in that tensor fascia lata. So really try to get some internal rotation and you should start to get that stretching. Another way we can do this is if you bend the legs just like this. So your feet are flat, take the unaffected leg, put it on top of the affected leg, and then just lower down just like that. And then that gets a good stretch in that hip as well. Try not to let your low back come off the ground too much. Otherwise, you'll be stretching your back more than the actual hip, okay? Some ways we can do it standing for that exercise is you want to come up to a wall. For the affected leg, you want that to kind of get, again, into that stretch position. And then you just want to squat down and let that hip drop to the floor. You can do some internal rotation of that hip to get a little bit deeper, okay? So that's the way we're going to stretch it standing. Once we have it passively stretched, meaning that we're stretching it just against gravity, we then want to work on our active range of motion with that. And the way you want to do that is you can come up to a wall, and then you're going to, again, internally rotate at the hip, and then you're going to start to extend, and you should feel a little bit of stretch in that TFL, that tensor fascia lata right there. You're going to hold this for about 30 seconds and repeat 2 to 3 times. Let me quickly show you how that looks on the ground. So we want to extend the leg out just like that, really contract through the glute muscle, and then extend. Externally rotate, and then reach back across the body. Just hold for about 30 seconds. Do this about 2 to 3 times, and then switch sides. Now that we've released the musculature and we've stretched it out a little bit, now we want to re-strengthen it and reestablish that neuromuscular control of that hip joint. So for this next exercise, we're going to work that glute, that posterior lateral portion of the glute maximus, as well as that tensor fascia lata, and we're going to do it with hip abduction. So to target the tensor fascia lata, what we're going to do is you're going to externally rotate so the TFL kind of turns outside, and then you're just going to tap heels just like that, and that's really going to work that TFL. And you're going to repeat this about 3 to 5 sets for about 10 reps. Now to work the glute portion that connects into the IT band, you want to internally rotate the thigh and then tap toes, okay? And that's going to target that aspect of this muscle. Once we strengthen the musculature of the tensor fascia lata and the glute max that inserts into the IT band, we then want to work on stabilizing it during motion. So I want you to do for this exercise is you're just going to come up a step, and you're just going to work on holding and maintaining control on the way down, okay? You can even touch the musculature to make sure it's activating and work on controlling it just like that. Repeat this 2 to 3 sets, 5 to 10 reps, and then we can start working on running form from there. So if you're suffering from that lateral knee pain, go ahead, give these exercises a try and see if they help out a little bit. If this information helps you, please like and subscribe for more content, health and wellness. Thank you.